Hello, I'm Dr. Mugdha Raut, a gynecologist and a clinical reproductive immunologist and co-founder of Dr. Raut's Center for Reproductive Immunology, India's only dedicated center focused on immune-related causes of infertility, pregnancy loss and IVF failures. We at Dr. Raut's Center for Reproductive Immunology treat couples with unexplained repeated pregnancy loss, unexplained IVF failures, and unexplained infertility with the active immunomodulation, Immulate, which is our patented and branded process, and other passive individualized reproductive immunomodulatory treatments. We have our centers in Mumbai and many other cities in India. Today, let us discuss why some pregnancies fail even after a heartbeat is seen. This is something that is extremely difficult for couples to understand and even more difficult to go through. Couples always ask us, Doctor, we saw the heartbeat, so why did the pregnancy still fail? Seeing a heartbeat is a moment of relief. After all the stress, all the waiting, all the fear, it feels like everything is finally going to be okay. But when a pregnancy is lost even after a heartbeat is seen, it can be devastating. Because at that point, you were not just hoping, you had started believing. So the question is, why does this happen? To understand this, we need to look at pregnancy in a slightly different way. Most people think of pregnancy in two steps. First is implantation, and second is the growth of the baby. But medically, pregnancy is not just about starting, it is about continuation. Implantation is just the beginning. For the pregnancy to continue, the mother's body has to keep supporting it every single day. And one of the most important systems involved in this process is the immune system. Now, let us understand something important. The embryo carries 50% material from the mother and 50% from the father, which means, from the mother's body's point of view, the pregnancy is partly foreign. Now, normally, the immune system does something remarkable. It adapts, it develops tolerance towards the pregnancy, and it allows the baby to grow safely. But in some cases, this immune tolerance does not develop properly or it does not sustain properly. And that's the key point. In many pregnancies where a heartbeat is seen, implantation has already succeeded. Early development has begun. But if the immune system does not continue to support the pregnancy, problems may develop later. This may present as loss after heartbeat, first trimester miscarriage, early second trimester loss, or even complications later in pregnancy. And this is where many couples feel confused because all reports seem normal, hormones, genes, normal scans, reassuring heartbeat, and yet the pregnancy does not continue. So they are often told it just happens, try again. It was bad luck. But when this happens repeatedly, we need to ask, is something being missed? In some cases, the missing piece may be the immune system's role in sustaining pregnancy. Because pregnancy is not just about starting well, it is about being supported continuously. If the immune system does not maintain tolerance, the body may begin to respond against the pregnancy, not aggressively but subtly, and that subtle imbalance may affect the continuation of pregnancy. This is why, in selected cases, a structured reproductive immunology evaluation may help identify whether an immune factor is affecting pregnancy progression. Once identified, targeted treatment may be planned. At Dr. Raut's Center for Reproductive Immunology, we focus on improving and maintaining immune tolerance through approaches like Immulate, our patented process of active immunomodulation, followed by individualized supportive therapy during pregnancy. The goal is not just to achieve a heartbeat, but to help the pregnancy stay and progress. So, if you or someone you know has experienced a pregnancy loss after a heartbeat was seen, repeated miscarriages, unexplained pregnancy loss, IVF failures, it may be worth asking, is the body continuing to support the pregnancy the way it should? Because sometimes the problem is not in how the pregnancy starts, but in how it is sustained. Thanks for watching. If you would like to understand whether reproductive immunology evaluation may be relevant in your case, you may consult us at Dr. Raut's Center for Reproductive Immunology on +91 9833201522 or visit www.icprm.in. DM us if you would like to receive more updates or refer a case. Let's spread awareness. Let's make science work for those who've tried everything. Because sometimes what's missing is what matters most. If you found this useful, please like, share, and subscribe. And do share this with at least one person who may be benefited from this treatment. You may change their lives forever.